when we call it hormonal acne, it is a true term, but I think that term has been misused a lot. And it's partly because of social media. And everyone, look, we see it and they go, look, your hormones are okay. But then they say, oh, no, it can't be hormonal acne because my hormones are okay. So I think it encompasses a lot of different types of acne. We call it hormonal acne because the main thing to understand is that in the majority of cases, so probably about 98% of the cases, your hormones are actually fine, but your gland or oil gland is sensitive to normal hormones. So what we call an intracrine abnormality, not an endocrine.
Right.
So you're absolutely right. The most common is hormonal, but obviously the other factors that come into play, which is like diet, stress, poor skincare, and for example, poor makeup use and not washing your face correctly. So there's so many issues in regards to that, even with diet as well.
So let's break down the different causes, because I think that this is a really interesting area to unpack. I want to first start with the topical things, because one of the great kind of explosions in the beauty industry is the many things we can do topically for our skin, and particularly in the anti-aging realm. And it seems to me, even though my background is from the cosmetic industry, I'm not a doctor, but I am from the cosmetic industry. And I remember, having been a C-suite executive for some pretty major brands in my time, the explosion of the number of things you can do to yourself at home and the explosion of the number of products that you can have on your skin at any one time, it strikes me as problematic.
Absolutely agree. So, as you know, now with acne, you read any blog, and I guess it's a double-edged sword, because a double-edged knife, because you've got so much information out there on the internet, and everyone is an expert, because you can Google how to treat acne, skincare ingredients for acne, best acne care, and you just have a million different things out there, and all the different skincare like you've perceived, and everything from naturopathic things like witch hazel and tea tree oil, all the way up to your topical retinoids, whether it be your adapalene, trifarotene, or your tazarotene or tretinoin, and everything in between. So I think where I think this is really bad is that with a whole amount of information out there, patients decide to pick and choose, right? And with that, for example, combining it's not to have a go at them, because I understand it's the influential people out there plus the marketing, and that's when they combine different things. They might go, cool, a beta hydroxy acid, something like salicylic acid wash, that's really good, so I'll use that. And you know what, a retinoid or retinol is really good, I'll use that. I'll use vitamin C because there's less pigment from the acne itself. But when they combine all of that, as you know, bad things happen.
So it's literally like conducting a crazy science experiment on your face twice a day.
Absolutely. And I think the majority of patients, just looking at how, this progression of knowledge out there for the patients, from the late 90s when I started in derm to now, we see this huge explosion. And that's why we use the word iatrogenic, in other words, caused by the person themselves. Yeah. And
most things in life are that way.
Yeah. And the vast majority of stuff we see now is irritant dermatitis, especially when a patient comes in with acne. You can see that their skin is irritated. They've ripped it off with their BHAs, they've laid their retinol, and they're wondering why their skin is so bad. And to be fair to them, I think, there's knowledge out there, but then, as you know, a little bit of knowledge can be bad.
Those two cleansers that you spoke of, both of them from the L'Oreal stable of brands, the thing that I understand about them is that they were developed as, pharmacy-grade cosmeceutical skincare, and they've been pared back. So really low in fragrance, low in irritants. Is that why you like them?
Yeah, so at the end of the day, as a dermatologist, like to control the known variables. And the most important variable to control is what's in the skincare. So that way we can decipher between an allergic contact dermatitis, irritant contact dermatitis, and go from there. So it's just about control, about knowing stuff, because it's impossible for us, because when a patient comes in, 9 out of 10 times that they don't bring their skincare with them. And when they do bring the skincare with them, there'll be so much chemicals, preservatives in there that it's hard for us to decipher. But if you keep the known variables, generally speaking, if something goes wrong, whether it be a contact dermatitis or what have you, we can read the ingredients very quickly.
And what about the moisturizer for the dermal barrier? Do you have any standouts that you think, you know what, I love this, it always works, it's nice and simple?
I think, look, to name a couple, Avene makes really good ones. LRP with their Cicaplast makes really good stuff as well. Cetaphil with their moisturizer, even though it contains, certain stuff like SLS. It's not about something that's good. It's about something that is low irritant, that doesn't cost the earth, that actually gets the job done. And that's what the moisturizer is for, to actually reduce your transepidermal water loss, improve skin barrier function.
So we've got a good cleanser, a good dermal barrier moisturizer. We've got an SPF. Do you ask your patients to have blood tests, hormonal testing? Do you do any other tests when in the instance of severe adult acne or sudden adult acne?
Yes. So to answer that question, when I used to do a lot of medical dermatology and treat acne, if patients come in their mid-20s, even late 20s, early 30s, I do a whole heap of endocrine tests, right? And I'll tell you why. It's because twice a year we'll pick up a tumor. And you heard me right, pick up a tumor. Because when you look at actual hormonal, when you use the word hormonal acne, the public will have a certain perception. The endocrinologists and dermatologists have a totally different prescription. So when we look at stuff like your 17-hydroxyprogesterone, your prolactin, your dihydroepiandrosterone sulfate, the whole heap of endocrine tests. Occasionally, like probably once or twice a year, I'll pick up a pituitary tumor because the prolactin's. Wow. So that's why I say in 98, 99% of the cases, you're absolutely fine. You have normal hormones, sensitive glands. In that 1 to 2%, you may have, for example, congenital adrenal hyperplasia. You may have an ovarian tumor. You may have a pituitary tumor. And that 1 to 2% is what the specialist is there for, because we pick up the rare stuff. So the answer to your question is that, yes, I do take blood tests. And before I refer them off to my colleagues, I always get the blood test as well. And you will pick up 1 or 2 a year if you actually look for it. One of the interesting things is this, because of the oral contraceptive pill, whether you're on drospirenone or cyclotone acetate, they actually camouflage a lot of your adult female hormonal acne, right? So in patients, when they go on it when they're teens or late teens and they carry it forth in their 20s, they're acne free essentially. And then at some stage, they've got to stop that. And that's usually in their early 30s. When they stop that, next thing you know, acne just comes out. So I think in this day and age, a lot of people are sweeping acne under the carpet.
So you think more of us have acne than we know we do?
100%. Yeah. 100%. So if you think about logically, and we see that all the time, my hormonal acne is actually better because of the pill. We know that. But when you stop it, it's going to come out. And those patients are left in a difficult situation because most often they want to conceive at that stage, which means 90% of all the acne therapies out there can't be used.
So let's go to scarring, because it's a perfect segue now to talk about treatments that are available. So we said, light therapy can potentially reduce the active phase of the acne cycle. But what do we do with the scarring? What are some of the options? I know there's laser, there's PRP. What do you like to treat acne scarring with?
Yeah, so we take one step back. And I do this a lot on my social media, the most important thing with acne scar or with acne is not to pick. So when you look at preventing or mitigating scars, something as simple and as cheap as an acne patch, 5 cents, 10 cents at most for one patch, that reduces picking. And by reducing picking, especially in late onset acne, you mitigate scarring. So if we take a step back, just using those, hydrocolloid dressings is super cheap, $5 to $6 from a Chemist Warehouse. That to me is brilliant. If they can have that on, so that way their lesions heal up quicker in a better moist environment that's bacteria free and traumatic free. That makes such a difference. From there, the algorithm gets really complex. So there's everything from lasers to surgery to chemical peels to, like I said, PRP, light treatment, IPL. There's a whole heap of different stuff. But I think for me, it's educating the patients to actually mitigate scarring in the first place. But from there, if you got acne scarring, it really depends on your skin type, your type of scar, the skill sets of your practitioner. The algorithms are really complex. So I always tell patients, let's try to mitigate this before you actually get scarring.
And in terms of sugar, we talked about the effect of sugar and inflammation. I guess that would be an obvious thing to cut out of your diet if you're in an anti-acne diet.
Yep. So anything found in a packet, generally speaking, I tell patients, look, anything found in a packet that tastes good, generally speaking, is probably not good.
And oils? Is there any kind of oil that we should switch to? Obviously, we know that palm oil is like butane for acne. Are there any preferred oils that you recommend as part of the acne diet?
Yeah, I mean, it's hard because you've got your, I think if you're going to cook something, probably olive oil would be good. I don't like the essential oils in the face. Yeah. So there is a big list of comedogenic versus non-comedogenic oils. I forgot that list, but all I remember is that it's not what you think. In other words, there's some oils out there. There's some oils out there which you can put on your face, which do not obstruct your pores. But there's a whole big list, and it goes from comedogenic all the way to non-comedogenic. So I might have like a rain check on actually expressing those oils.